Hi, my name is Jackson Edwards, MedicareNationwide.com. And as of today, the 2025 drug plans have been released. So this is October 1st. It's about 9:30 a.m. I've taken a little look at the comparison between 2024 and 2025, and there are some big changes that you should be aware of. Most notably, 6 plans, at least in Florida, have been removed. I'm just going to focus on Florida for this video. Every state's a little bit different, but for the most part, they're pretty much the same. So 2024, 20 plans available. 2025, there's 14 plans available. One of those plans being one of the most popular plans for the last several years and will impact people the most. Many of you may know that there was the Inflation Reduction Act of 2023, where the cap on the amount you can spend for your medications is now $2,000. So we expected premiums to increase to offset that cap that was implemented, and it appears that that was the case. So I'm going to go through a few examples. I'm going to put in some common medications, and then I'll put in an expensive medication, and we'll see kind of how the Medicare.gov system reacts, and maybe you can apply that to your own situation. And as always, if you need any assistance, you can give us a call at the number on the screen, and we can talk to you about your medication list. So let's kind of go through it live here. So we're at Medicare.gov. You can put this into your browser. Everybody has access to this tool. So you go to Health and Drug Plans, then go to Find Health and Drug Plans. And let's go to 2024 just to start. I'll just put 33065 and just drugs here. I put don't get any help from these programs. Do you want to, yes. So we'll just put in a couple of common medications here. Simvastatin, a lot of people are on some kind of statin. We'll put in a blood pressure medication, lisinopril. And then, let's do this for now. Done adding drugs. Let's compare CVS and Walgreens. Any CVS? No Walgreens nearby. Let's type in Walgreens. All right, we'll do that. Now we have 2 here that we can compare. You can compare up to 5. We'll hit done. And this is how it's going to look for 2024. So you're at the top left corner. And if you want to do 2025, you can click that link there, which we'll do in a moment. So what I wanted to first show is that there's 20 plans to choose from, at least in Florida. So per given state, there's plus or minus a few plans. So sometimes there's like 21 plans. It all depends on the state that you're in. So now we'll go to 2025 plans. And now we can see that there's 14 plans available. And I've made a nice comparison sheet, which I'm going to get into in a second also, and I'll make that sheet available to you so you can look at it and see how you might be affected. So I personally was very worried that this WellCare Value Script plan was going to increase, but it did not. So it still remained 0, at least in Florida. Other states, again, might be different. If we scroll down the list, we can see the next premium down is $530. So it looks like WellCare is going to dominate the market for the most part, like they did in 2024. And then we'll go down a little bit more. And then the third cheapest drug plan is $27, which is a huge gap compared to 2024. It was a lot, incremental than it is for next year. Then we go down to 41, another big jump. 51, big jump. 48, 94, 92. So you can see overall the premiums for next year have definitely increased. So let's go in and, well, you can look here. So we can see that the total out of pocket for these medications that we put in are 0. So that means they're going to have 0 copays on that. The deductible has gone up a little bit. I believe it was $545 in 2024. It's gone up to $590. Usually there's like an average deductible amount, so the average is going to be about $590 for a lot of plans, but you will see some differences. So here's $590 again. This one's $590, and this one's $573. So you'll see some little differences here and there, but for the most part, $590 is going to be that deductible that you're going to be seeing. Let's open up the plan details of this plan, and then we'll do another example in a moment. So if we scroll down, we can see that it's $0 copays for both of these medications at both Walgreens and CVS. Okay, I think that's good enough for this example. Let's go back to results here. Go back. And let's put in, I just want to put in Novolog just to look at that, that cap that they put on the insulin medication, diabetic medication. They put a cap on that. So let's just see how that's looking for next year as well. And then I'm going to put in a really expensive medication to see how that Inflation Reduction Act is coming into play. You can open up these pharmacies here, and yeah, you can see that there is that cap of $35 on the Novolog. So that's all matching up. So if you were ever on diabetic medication, you know how expensive it used to be, and now you're getting a significant amount of help on that. And it looks like, at least in this example, for the Novolog, the Humana plan is coming up best if you're on Novolog specifically. So you would pay $938. It would be your annual out-of-pocket, which includes your premium cost. And the next best one would be Blue Medicare for about $200 more in the year. Okay, so now let's look at a more expensive medication to see how that looks. And then I'm going to show you the, I made a nice, my assistant Jen helped me design this nice spreadsheet where we compare the 2024 and 2025 drug plans, and we look at the percentages and all that stuff. So we'll get to that in a moment as well. So let's add an expensive medication, Lynparza. I know this one was a killer for 2024. Let's add this to the list. This is a cancer medication. We'll hit done. And this is my first time actually doing this, so we're going to see this live together. All right, so it looks like the Humana plan came up best again. And look at that, there's a cap right around 2,000. So that Inflation Reduction Act of 2023 is in play here. There is indeed a cap on how much you can spend per year. This is going to be a major, major help to many people out there that are on expensive medications, especially the cancer medications. So you will have to pay that entire amount in January if you're on one of those expensive medications, but then you have no more out of pocket for the remainder of that year. Okay. Let me just do a little more looking here. Yeah, so that's great. So I think that kind of gives a rough overview. Again, if you need more personalized assistance, you can give us a call at the number on the screen here. And now let's get into this sheet that we made. So here is the spreadsheet comparison of 2024 and 2025. Again, I'll have a link in the description where you can click it and you'll see this exact spreadsheet. So don't worry about writing things down or anything like that. So overall, the percentage change in premium went up about 8.5% increase, and the deductible went up about 13% overall, which is about normal, at least for the deductible. So here you'll see 6 plans have been removed, at least in Florida, and this will be very similar throughout the country. And the biggest thing that I see is this SilverScript Smart Saver plan. A ton of people are on this plan, and they will be the most affected. Typically, what I have seen is that if a plan gets removed, the company will put you on their most expensive plan. They're going to notify you that they're putting you on a new plan, but it will be generally their most expensive plan. So if we look at this Silver Script plan, they're likely going to put you on this Silver Script Choice plan. This is just a hunch. Don't quote me on this, but they're probably going to put you on this $48 plan in 2025. So be on the lookout for that. If you have a Silver Script Smart Saver plan, you have to do your research for next year. You should be doing your research anyway, but if you're on this plan in particular, you really need to do your research. It appears that if you're on the WellCare plan, at least from my short example that I did, you're not really going to be that impacted, which is great because probably 80% of people have that plan. So that's going to be, that's a weight off my shoulders. I know that. That's going to really cut down on a lot of work that we have to do. So as soon as I finish making this video, we're going to get to working on our clients' drug plans for 2025. We're going to be doing a ton of reviews. And if you feel like you're not getting that good service and you're having to worry about your drug plan every year, we would love to have you as a client. We take care of you completely. You never have to worry about anything Medicare related. We automatically do your drug plan every single year, so you never have to worry about saving the most money. So you can give us a call here. I'll pop the number up on the screen again. Okay, I hope this was informative. If you found it informative, please like the video, please subscribe, please share it with anybody that you think could use this kind of information, and I'll see you in the next one. Thank you.